To the fentanyl emergency now. Leaders in Multnomah County are not pleased with the progress by the Tri-Government Unified Command charged with the crisis.
Yeah, KOIN 6's Ariel Salk live outside the county building. And Ariel, this was the concern: lack of communication, lack of coordination.
Absolutely. Last week, county commissioners criticized the Unified Command for a lack of substance in their presentation, and this week was no different.
It just struck me as so out of touch.
It's been nearly 50 days since Multnomah County declared a 90-day emergency declaration for fentanyl.
It's good to have a campaign to encourage people to get treatment and go into recovery, but if we don't have a plan to actually have people be able to access treatment, then we're really missing a key piece.
Resulting in the creation of a unified command with the city of Portland, Multnomah County, and the state of Oregon. Today, county leaders were presented an update.
I feel like there is not a sense of urgency to any of what is being talked about,
including a billboard campaign, which KOIN 6 reported on last week.
Inspire hope and direct resources to our partners like Lines for Life and Recovery Network of Oregon so folks can find the support they need.
But some commissioners believe this tactic is out of touch.
The idea that those are up there without highlighting anything about the emergency or the crisis is, I don't understand that.
One billboard in particular showing people going camping shocked commissioners.
The first thing that struck me about it was how tone deaf this was in terms of what's happening on our streets right now and the messaging around camping.
That one is not going up right away. And Diego Basabe with the health department spoke with people from recovery while creating it.
That one was informed by lived experience and living experience.
Commissioners were also concerned that the supply chain of the drug was not addressed in the presentation.
If we don't address that or even talk about it, then we're never going to get a hold on the demand side of the equation.
Commissioner Brim Edwards says it's good to have a campaign to encourage people to get treatment, but it's simply not enough during an emergency.
What I really want to see is some really very concrete actions, which is a plan that will ensure that we have the adequate treatment beds for people who seek and want treatment, because we know we don't have that.
Now, one thing the commissioners did applaud is an overdose data dashboard, which will track fatal and non-fatal fentanyl overdoses and update that weekly. Reporting live in downtown Portland, Ariel Salk, KOIN 6 News.
Yeah,